Hi, this is Clark Simpson, presenting to you the course on third-party reimbursement for services provided by athletic trainers in the collegiate setting. My name is Clark Simpson. I am President and CEO of the Clark Group Associates. Clark Group Associates is a for-profit organization. We do consulting in the sports medicine athletic training space. You can see from this slide, we do work with national associations, one of those being the National Athletic Trainers Association. We've worked with numerous state associations, as you can see here, as an example of some that we've worked with, as well as we've worked with a lot of university collegiate sports medicine programs. So I do want to make sure that you are aware that myself as President and CEO and Clark Group Associates, we do consulting and project management with athletic trainers and with sports medicine professionals, and wanted to make you aware of that. The learning objectives that we have for this course are listed here. Number one, we do want to be able to, at the end, to be able to explain the difference between athletic training billing autonomously and billing under the supervision or the MPI number of another provider. Second learning objective is to point out copay, deductible, and co-insurance issues that may be raised by insurance contracts or the OIG, the Office of the Inspector General. And third learning objective is want you to be able to classify medically necessary services that could be appropriately billed to insurance carriers. So as we move into this presentation, these are all things that we're going to be talking about in the presentation. These are all considerations that you, as someone considering billing in the collegiate setting, are going to need to think about and consider. University healthcare policies for student athletes. What is your policy? What is the university policy? What are the rules and regulations that if you are an NCAA 1, 2, or 3 division? So what are the hard and fast regulations? What are the cultural issues? What are the policy and procedures that your specific institution have? Second, what is the licensure, the scope of practice for healthcare professionals in your particular state? For athletic trainers, in particular that we're talking to here, but if there are others that would be billing, if you're billing for physicians or physical therapists or et cetera, to make sure that you do understand those scope of practices. Third, what healthcare provider is going to be designated as the billing authority? Is that going to be athletic trainers? Is that going to be under physician? Is this being billed under the university tax ID number? So what are the designations and who is the billing authority that this is going to be coming under? What is the determination of the sports medicine services to be billed? Quite often we tend to think of just rehab, but there are a lot of different things that we can bill for, all the way from pre-participation physicals to obviously the rehabilitation that I mentioned, to DME aspects, or if you're a university that actually has DEXA scanning, to be able to do that. Are you going to be billing for physician services if your physicians are treating patients, doing suturing, setting and doing any casting, hanging IVs, those kind of things? So there's a lot of things that, depending on the university and depending on the setting that you've got, could be billed for. You're going to need to understand the documentation standards that are going to need to be met. If you're billing a third party in doing this, what are those standards that do need to be met to be able to bill? And then finally, are you meeting the insurance in-network or out-of-network standards that need to be met from the contract or from a legal issue? Do you understand those, and are you meeting those? As we get into talking about the kind of the culture and what you need to understand in your collegiate setting, I've gone through and taken a look at some of the specific rules and regulations that the NCAA has. And so, as you can see from the slide that I have up, this is a Division I, NCAA Division I student athlete, and what their regulations are on insurance. This was an actual survey that the NCAA conducted, and you can see I've got a link here so that you can be able to see a lot more of the detail in this. But this would help you if you're in a Division I school, and you may have even participated in the survey. What's some of the information? In all the NCAA schools, and we'll see this, in the bylaws, student athletes insurance coverage must be at least $90,000. It can be $75,000 if the university is participating in the group basic accident medical program. So it's going to be either $90,000, or if you're participating in this basic accident medical program, it could be $75,000. Now, how can these policies be provided? They can either be through the school itself. It could be a parent or guardian's policy, or it could be a policy that the student athlete actually owns and has acquired themselves. After this $90,000 base coverage, then every school must have the NCAA catastrophic injury policy, and that is up to a $20 million lifetime benefits. So the first $90,000 would be covered under a insurance policy that we've just described above. Then above that is a catastrophic plan. So for those very significant injuries, the spinal cord injuries, significant concussion injuries. It could be some of the significant fracture or multi-fracture injuries, that we see. And you see that pays for medical expenses, disability cash payments. These are injuries that are probably going to be a lifetime of care. One of the things in understanding the culture of your university, and this is really why I'm getting into this survey, is to understand, and you need to look at your university. And I'm just kind of giving you the results of the survey. But the survey indicated that 86% of Division I schools, the student athlete do not have any out-of-pocket expenses for an athletic injury. So zero expenses. There's no balance billing. There's no cost to them at all for an athletic injury. There are some out-of-pocket expenses, and those do vary from institution. Some of those out-of-pocket expenses may be for prescriptions, or if the athlete or student athlete is seeking a second opinion. And again, that's going to be a decision that your athletic department or your sports medicine department have made, and what is the policy that you have. It was interesting in the survey, did demonstrate that 93% of athletic departments do manage the insurance program for the student athletes. And out of that 93%, it did indicate that athletic training staff, 77%, dedicated insurance coordinator, athletics administrator. And so even for the breakdown, not only the athletic training staff, but probably all of these, if the athletics department is managing, are probably falling under sports medicine. So it may not be the specific athletic training staff, but it very well may be falling under, if you're a director of sports medicine or whatever associated title at a university, you could very well be managing this. And it was interesting in the finding of the survey that 6% of institutions do require student athletes to provide their own coverage. Again, you can read the slides that come up here, and we're not going to go through, and certainly the purpose of this presentation is not a reading exercise. You guys can see that. The main point that I'm trying to reach here and in the next few slides is for you at your institution to understand what is the policies, procedures, standards, the culture that your university has. That is going to make a difference then as we move forward in some of the other considerations we get into. You can see here that the NCAA also has done a survey for Division II schools, and I kind of highlight this. Again, we've got a link in the resource that if you are a D2 school and want to get in and look at the specifics of this, you certainly can. The same bylaw for the $90,000 first $90,000 insurance coverage, and then going to the catastrophic claim. Same sources for insurance coverage as D1. Again, D2 here, we see the 86% of institutions require the student athlete to have primary insurance coverage. 92% institutions provide insurance if the student athlete does not have primary coverage. 64% purchase a student or purchase accident insurance policy, and of those, 85% actually pay a premium between $25,000 and $200,000. So this demonstrates what is going on in the Division II realm. So what is going on in that particular area? And again, I drive us back to the whole purpose of this is not all the statistics and what we're talking about here. What is important is what is going on in your institution and understand that. The survey covered what's going on with the international student athlete and what's usually covered and in handling that. Division III, there has not been a survey, at least there was not done at the time that this information was pulled up, but again, it would have the same basic coverage of first $90,000 being covered, then going to the catastrophic with the same sources of coverage going with that. With NAIA, if you're from an NAIA school, there are requirements that your school has to have a catastrophic insurance or injury insurance. And this kind of lists out $25,000 deductible per incident, $5 million aggregate limit per accident. I was not able to find any of the specifics of the schools as far as other than this catastrophic injury insurance. So what is, if you are an NAIA school, again, what is your policy for student athletes, their insurance? What do you all as a school or an athletic department or a sports medicine department cover? What don't you? With the National Junior College Association, I could not find any documentation specifically on insurance coverage. Not to say that there's not something out there, but I did not have any luck finding out anything with that. So before we start talking about the slide that I have up here, I'd like to kind of bring to an end talking about your specific instance, your specific institution where you're at. We have what are some of the policies, whether you're an NCAA school or NAIA or junior college type of setting. But even within those, we've got private Christian schools and other cultural situations that come in that the decisions are made on how we want to handle and how we want to treat our student athletes. Or how we want to, or how we can afford to treat our student athletes. You need to understand those as you're starting to look at, is third-party billing for services an opportunity or a possibility for us. The next consideration that we have here is for you to understand how would services be billed if you were to bill third-party services at your collegiate setting? Is that going to be autonomous billing, billing that as an athletic trainer, as a standalone professional under your NPI? So are you going to be the recognized provider in billing that? And I explain here what that amounts to relate to that. So that would be you as an athletic trainer billing under your professional provider number, the same as your team physicians or any of the specialist physicians you have, or if you refer to a physical therapy group or et cetera, and what they do. So that is what we're meaning here by the AT autonomous billing. Or is it going to be, and I put quotes, incident to billing? Now, the reason I have quotes here to explain that is incident to is very specific language to Medicare or the CMS system. As athletic trainers, since we are not billing Medicare and since we are not recognized by Medicare as qualified healthcare professionals, technically we could never bill incident to, or the quote unquote. However, we can bill underneath the supervision and monitoring an extension of a physician if we meet certain standards. So this is important for people to understand. Billing as a standalone athletic trainer, as a standalone professional, or billing underneath the supervision and really the liability of another professional. Now, our goal professionally would be to bill autonomously. That's our preferred methodology. We want to be recognized as qualified healthcare professionals. That gives us the professional recognition and freedom to be able to do that. That does not mean that if you're in a situation of billing under a physician or other qualified healthcare professional that is going to be listed out in your State Practice Act, that there's anything wrong with that. But from the professional recognition standpoint, at the highest level, our goal would be able to bill autonomously. And certainly that's what the third-party reimbursement initiative is all about, that the NATA is leading. That would be where we'd want to go. But that does not mean that the thousands of athletic trainers across the country that are working in hospital systems, in physician practices, et cetera, that may be billing underneath that supervision is bad or wrong. There's just a difference, and we need to understand that. What's the legality of an athletic trainer being able to bill for services? Out of the 48 out of the 50 states, and that includes California that does not have regulation, it is legal for an athletic trainer operating under their license, regulation, their scope of practice to be able to bill for services. It's legal for them to do that. The two states that I note here, Kentucky, South Dakota, actually have in their practice acts that they cannot bill a third party for services that they are providing. Both these states and the state associations are working hard to update and change these practice acts, but as at the time of this recording, currently both Kentucky and South Dakota have these limitations in the practice act. So those are the legal aspects from that. What are the business issues? Well, unfortunately, the majority of states, the insurance companies, whether that's the insurance companies, the insurance commission, work comp commission, do not recognize athletic trainers as qualified healthcare professionals in their plan. It just may mean that they do not know who athletic trainers are. They do not know what we as athletic trainers can do, what our scope of practice is, what our license indicates that we're able to do. The reason I put this as a business issue is we've already covered, what's the legal issue? What can you legally do? But just because you can legally do something does not mean that from a business standpoint you'll be recognized and compensated, and we have to understand that. Exceptions to some of these are some of the work that's been done in the third-party reimbursement pilot and initiative. Indiana, Wisconsin, Vermont, Missouri, Georgia are some of the states that come to mind where athletic trainers are billing as standalone autonomous professionals, and that insurance companies are knowingly paying the athletic trainers or reimbursing them, so they recognize them for this work. One of the discussions that often come about when we get together and talking about third-party billing in the athletic training space is this incident to billing. And again, as I've explained, that really for us, that is, as an athletic trainer, we're billing under another healthcare professional's provider number, under their liability, under their direction. Incident to billing is, the Medicare is the one that sets the standard for that. Incident to really is Medicare language. But even if you are billing in a physician practice or a health care system under that other healthcare provider, while you're not billing Medicare patients, the Anthem Blue Cross Blue Shield, Cigna, United Healthcare, Humana, Aetna, they have their policies that they follow. And the majority of the time, not 100% of the time, but the majority of the time, insurers will tend to follow Medicare guidelines. Medicare guidelines tend to be the gold standard that are in the insurance industry. Now, I do need to emphasize, not all the time. And so that needs to be researched. So again, this is another one of those aspects that need to be understood and appreciated when you're considering, can we do this or not? And as I note here, only a minority of payers do not follow Medicare policies. In the work that I and my Clark Group Associates colleagues have done, we found that usually what we consider the big five, so the Anthem Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, Humana, those payers almost always follow Medicare guidelines when it comes to this type of billing. One of the things to note is that if you understand Medicare guidelines and are following Medicare guidelines in whether it's in this or other type of coding, et cetera, that we'll talk about, compliance is going to be ensured. If you follow Medicare guidelines, which is always going to be the highest standard, you know that you will be compliant. And that really is something that I note here. The NATA does have a paper out that's put out by the Third-Party Reimbursement Initiative Group, and you can see the link that I have posted. But the NATA officially recommends that athletic trainers should line up with Medicare policies and procedures when billing services under a physician. So we've kind of gone through, we've talked about autonomous billing or the billing under another's provider. So you've made a decision, you have to consider that. How are you going to handle in this particular state that you are, the institution with where you're at? What do the payers recognize? One of the things that all payers, and if you did your own search and went out and looked at any health insurance provider, and looked at what do they pay for. And if you Googled a medical necessity, you're going to see a definition similar to this. And so what I've lined out here is kind of a combination as looking at numerous insurers and how they define medical necessity. And I'm going to read this. Healthcare services that a physician or other qualified healthcare professional exercising prudent clinical judgment would provide to a client for the purpose of evaluating, diagnosing, or treating an illness, injury, disease, or its symptoms. So in some form thereof, whether it's any of the big five that I've mentioned before or some other type of insurance, all insurance companies are put together as a business to be able to pay for certain benefits. They do not pay for everything. So to compare medically necessary that we're looking at here, in which insurance companies pay for, they do not pay for prevention. They do not pay for education. They do not pay for health and wellness, usually, activities. If they do, they would be listed in their benefit package. So they don't pay for maintenance care. So medically necessary is important for us to know and to note that that's what insurance companies are looking for. So how do we know something's medically necessary? We've seen kind of the definition there, but if we think about what we do as athletic trainers and some of the sports medicine examples, well, any of our student athletes that have a surgical intervention is going to fall into, if we're doing rehab on them, to medically necessary. To be able to utilize a time lost criteria, and one of the things that we recommend as a consulting firm is to look at 5 days of lost time. So if you have an injury that is causing the student athlete to miss at least 5 days of time from practice and competition, then there's a good chance that that injury is falling into that medical necessity. And some of the things that obviously we work with, second and third degree sprain, strain, contusions, fractures, dislocations, spinal injuries are all going to fall into those things. Some of the other aspects that I have listed there, pre-participation, physicals, the medical procedures, DEXA scans, durable equipment. And the thing that I would want you to make sure and note, durable medical equipment is for the injury and rehab, not for prevention. So if your policy is for all of your offensive linemen to have braces and et cetera, from a maintenance or prevention standpoint, those are not billable services. If you have an offensive lineman that have had a second-degree MCL sprain and they've rehabbed, and you've got that for a rehab injury situation, that brace very well may be covered by insurance in that situation. So you have to, the durable medical equipment, it's why it's being ordered and what it's for, again, from a medical necessity standpoint. And it really needs to be noted that, you have to recognize the coverage is governed by the terms of the really of the policy. So there are literally thousands of different policies, even with just Anthem Blue Cross Blue Shield. They have, I would say, probably thousands of different policies just within that company and variations of that. So there's a lot of different levels to this, and so it's always going to be indicated by the particular policy that your student athlete has. It's been my experience as I've done work with different sports medicine athletic training rooms across multiple collegiate settings, that and over my career, when I've looked at from the medical necessity of what we actually do as athletic trainers in the athletic training room, I estimate 20 to 25% of the work, the treatments that we do would meet the medical necessity definition. So to flip that, that's saying that 75 to 80% of what we're doing does not and should not be billed to insurance. It would be inappropriate to bill them, and if insurance knew what it was for, they would not reimburse. The example of there is, again, as athletic trainers, we're seeing whether it's the baseball pitcher that's coming in with the sore shoulder and doing that, and we're going through different treatments, utilization modalities, et cetera, to treat them, but the pitcher is still participating, or the football quarterback, or the swimmer, and I'm kind of talking about shoulder injuries here. They're still maintaining, still continuing on. There's not an injury. Versus if they've had a subluxation or a dislocation, they have some type of impingement, or et cetera, where they're actually out of play, and we're rehabbing them appropriately. Then that then falls into the medical necessity aspect. So that's the difference. Now, I know that there are institutions that are doing billing that are billing for a significant amount of issues and things that go on in the athletic training room that do not meet the medical necessity standpoint. These are not necessarily illegal. It's just that we need to understand that insurance companies are not set up as a business to pay for these. They specifically lay that out in their policies. And so while we may be billing them, and we may be getting reimbursement for some of these policies, in the end, they will eventually be found out, and that will end up being bad for the entire profession of athletic training, in my opinion, because basically that would cast a shadow of that particular insurance company, and it's a fairly tight community, so that's going to spread, that athletic training is really trying to gouge them or trying to manipulate and get money for things that insurance companies really are not set up to pay. Again, the prevention, the maintenance, performance enhancement type of things that insurance companies really are not set up to pay. So we need to be careful with that in the long term as we move forward. I put this in, one of my favorite quotes from Ed Deming. We do not have to change, but staying in business is not mandatory. Dr. Deming, back following World War II, was actually sent by the United States to Japan to help them rework their manufacturing and economy and to get them around. And what we see today with Japan's significant attention to detail and that sort of thing comes from the work that Dr. Deming did with them. And it was a great proponent of evaluating change and knowing that you need to continue to change appropriately. Documentation, just a favorite topic of so many athletic trainers, and I know if you're on this course, you probably sighed in seeing this. Documentation is definitely not the fun part of our job. I don't know of any healthcare professional, whether you're athletic trainer, physical therapist, nursing, physician, or whatever, that likes doing documentation. But it is a necessary evil, and we need to be able to do that as athletic trainers, and we need to do it well. Some of the things that we really need to make sure that we've got good documentation when we're talking about insurance billing or third-party reimbursement are some of the things that I've noted here. We really need to have specific orders for athletic trainer physical rehabilitation treatment for the student-athlete injury. So just the standing orders that we have from our team physician for monitoring, and that we're seeing that, really does not suffice. The insurance company, if they requested the prescription or order to treat, would not accept a standing order that you've got for your entire program to be able to see. So my recommendation, always as a consultant, is to have specific orders for anyone that you are billing for, that there are orders that are documented in, and hopefully your electronic medical record aspect. So we're not chasing a bunch of paper, but it's something that is noted and that the physician has ordered that for athletic training. So it's for you as an athletic trainer, physical medicine rehab, for sports medicine, any of those aspects. It cannot be for physical therapy, occupational therapy, unless you are dual credentialed as a physical therapist or occupational therapist. So the order needs to be proper. Student athlete needs to be treated by the licensed athletic trainer for the billable service. So in our athletic training rooms, where we may have GAs that may not be licensed or not, or certainly undergrad students currently that are not licensed, those services are not billable. So they need to be treated by the licensed professional to be able to bill for those services. The services we have to meet the CPT coding guidelines for service and time, and that's a whole nother topic on billing and coding and the appropriate time aspect to be able to bill for the 15-minute codes. So if you haven't had that, some of the courses and information's out there on the NATA website, or we have courses on Billing 101 or Billing Ethics that you can also look at. But these guidelines need to be met and should be met. Plan of care, again, from the documentation standpoint, you as an athletic trainer should be doing all of the appropriate SOAP note type of things, laying out the plan of care to do that, and then that plan of care should be looked at and signed off on by the physician. And I mentioned the SOAP note, so whether it's an EMR that you're utilizing or not, almost all documentation that I'm aware of usually follows mostly into a SOAP format of the information that we have here. All of you know that. And then where we tend not to be really good, and especially in a very busy athletic training room, is laying out, the plan. What is the plan when we're doing this? What are our physical goals? And, we list here the SMART goals that we really need to list, and these need to be documented for the student athlete and what we're doing. Hopefully you've got a good EMR that have drop downs and can assist you in being able to document these quickly, but they are important to be able to have. This is not telling you anything new. Documentation takes time and resources. It is not fun. It is not. It is probably the least liked thing that any of us have to do is documentation and writing and administration time. That's not why we do what we do. But if it's not written down, it's not done. And in the insurance world, you've got to have that documentation all the way from the physician, the orders, the amount of time of treatment, who's doing the treatment, the plans, and et cetera. Those all have to line up to be able to meet insurance guidelines. So a point that I do think is important to make here is that this documentation really should be done regardless of whether we're talking about third-party billing or not. It's important for us as healthcare professionals, no matter what setting we're working in and whether we're considering third-party billing, that we are doing appropriate documentation for multiple reasons, and we won't get into all that. lastly here on the policies for the entire staff to follow. This is something that is my recommendation to athletic training staffs in the collegiate setting, whether you've got 2 or 3 on staff or whether you've got 15, that you really need to, just like at the beginning of the year when you're going through all the other clinical aspects and spine board work and discussion on concussion and how we're going to handle those things, is a discussion on, we have this certain documentation standard. And again, hopefully most or all of you have some type of electronic medical record system. But how are you utilizing that system? How are we as a staff going to do this? Because every system that I know of has many different ways that it can be utilized within that own system. And so if you have 10 different athletic trainers that are going into this, and they may all be utilizing the system, but you may all be listing, some of these things that I have here differently as far as injury type, severity, loss of time, etc. Either how you're listing that injury and whether that you're listed as a head injury versus a concussion, and what's that listed. Why is that important? Well, we get back to the value of who we are as athletic trainers and trying to demonstrate that and come up with that work. We need to be able to run reports. We need to be able to have that objective data. And if we have 10 different people doing things 10 different ways or 5 different ways or 3 different ways, then that data is not going to match up. And so we really need to hone in as closely as we can to be able to have consistency when we as a staff are documenting and putting things in the EMR the same way. And not only that, but that we are all kind of touching all of these points. I've done a lot of different work with a lot of different collegiate settings, and I can tell you that I've worked with some very good and big athletic training programs, but when I get to trying to pull information and data and to follow what they're doing, this falls apart time and time again. So please work on this. This is something that's very important for us professionally. We've been talking about EMR. Just here are some of the EMR programs, far from an exhaustive list. These should be familiar to the majority of people taking this course. What's important is for you as an institution to be able to look at what is it you need, what is it you're going to utilize and work with. And you're also going to need to work with your IT security system and policies. There's a lot of different policies that I've worked with IT groups across the country. Some of these programs meet the standards of the IT security system. Some do not. So you need to work through those. But the best system that meets all of the criteria you have is worthless if it's not utilized and if it's not utilized correctly. So please look into that. We really have to get into the 21st century here, so it's very important that we are getting and utilizing EMRs and doing that properly. Copay, deductible, and coinsurance. Something that all of you, I know are aware of and we deal with student athletes. This goes back to the start of the talk when we were talking about, what is the policies of the NCAA, what is the policy of your specific institution. Are your student athletes going to have be paying for anything? Is the athletic department or sports medicine department completely covering all costs? How is that being handled? So that has to be understood, and then that directly affects this topic that we're talking about. I think all of us know on our own insurances that we all have, in this day and age, different co-pays, deductibles, or co-insurances. So if you as a provider, and now we're talking about you as the Collegiate athlete training sports medicine professional, and if you're doing billing, if you're wanting to bill insurance as an in-network provider, then you're going to have to go through the credentialing contracting process. Again, that's an entirely different talk and work to do that there are other presentations for. But if you are, or if your institution is in network, and your institution may already be in network, your student health services may be billing, or you may have a physical therapy program, or speech and pathology, or dietary that are doing some billing across campus, and you may be in network with insurance companies already as you do your research. But regardless of that, if you're billing in network, basically you are signing, or not basically, you are signing a contract with an insurance company to meet certain standards. These contracts almost universally have language that require that you, the provider, must collect or attempt to collect the copay deductible coinsurance from the insured party. To not attempt to do this, or to do it, to just say, no, that's not covered, and to what we call write it off or not collect it, can be considered fraud. It can be considered breaking the contract that we have signed as an in-network provider. Now, can some of these services, or all, be waived? You know, that's a question that I get frequently when I consult with people. Well, there are circumstances listed here. Many people are aware of the hardship waiver, and there are institutions and groups that have gone around the country, and really recommended to collegiate settings to have everybody sign a hardship waiver. If you're trying to bill, we've had groups that have done cardiac testing or other type of work with that, and with recommendations of utilizing a hardship waiver. Well, if that really is audited, first of all, the hardship waiver it's the hardship on the owner of the policy. So if it's student athlete, but if it's on their mom and dad's policy, is their mom and dad in a hardship aspect? So it's not the student athlete who's in school, it is mom and dad. If a student athlete owns it, well, are they? And do they meet the hardship aspects? And there is very specific criteria that has to go through and meet. Now, the difficulty here is that I have heard individuals say, well, just have all of your student athletes, be able to sign the hardship waiver and be able to do that. I mean, they're college students, they don't have any money. Well, the problem with that is that many of you institutions, you're ranging from having 400 to 600 student athletes that you're taking care of. I can guarantee you, no matter what the institution that you've got, that not all of your 400 to 600 student athletes are meeting the hardship waiver. I would say that only a very small percentage of most of you are meeting that. There are some institutions that there would be a greater percentage, but in no case would all of your students meet the hardship waiver. The other possibility is the Student Assistance Fund that in the D1 schools that the NCAA set up, and there's money set aside that the NCAA has a formula in which they have money that comes back to the institution, and there are 4 specific areas that money can be spent for. Healthcare is one of those areas, and even paying for insurance policies and doing that. But that is a finite amount of money. So when that money is spent, it's gone. And so while there is a bucket of money there, it's usually when it's spent for any of the four aspects, and some of those things are on tutoring and computer needs or other type of aspects. So when the money is spent out of that bucket, it's gone. And so usually that money is already assigned, if you will, and is really not available. And then we have a university student health fee. Many institutions have got fees that they charge all students for access to the university student health system. It has been looked at from legal aspects that for the universities that have this, that often these student health fees will meet the copay requirement. But that's the copay requirement. And again, that's for the institutions that don't. I've worked with a lot of institutions that their collegiate setting does not have this student health fee. So the question is, do you have it? How much is that? And that would take care of copay, but then how do we handle the deductible? So we've been talking about, these are all various things we've been talking about for the in-network provider. Again, I've had multiple conversations with universities say, well, we won't worry about billing as an in-network provider. We'll just do out-of-network. We don't have to sign a contract to do that. So since we're not signing a contract, then we're not held to that standard. Well, there's some work that's been done, and I list the source here with a medical legal attorney specialist that I've taken this information from, that I've worked with. And these next few aspects are all different issues that can come up for the out-of-network. And you can see here the tortious interference. You see the description here. When it talks about an out-of-network waives a patient's financial responsibility, basically the insurance company is saying that you're trying to get in between us and the patient on this insurance policy that they've signed up for, and that violates law. The second aspect that is talked about, you know, there are state insurance fraud laws that prohibit claims that are false or misleading. And so what I've listed here essentially says that if you are billing somebody, let's say billing a $150 bill, but you have no intention or ever thought that you would actually collect $150, that you know that maybe you'll collect $50 of that, and that there's going to be $100, you know, left in that, that you're just going to write that off, and you're going to be very happy to collect that $50. Well, since you had no intention of collecting that, you know, that really was not the real or truthful charge for the service. And so again, that is providing misleading information and violating that. Common law fraud, and again, somewhat of the same sort of aspect that the attorney goes through here. A misrepresentation is made, you know, and there was no intent that the amount that was billed was going to be paid and was going to be written off. So basically, we're looking at waiving a patient's financial responsibility while submitting a claim to an insurance listing the full charge could constitute common law fraud. So all of these come into play without ever signing the contract. And these are things that as everyone's budgets, including insurance companies, tighten up, that they start looking, you know, much harder at. So from the billing sports medicine services standpoint, this course, this conversation is not about how do you do this. How do you, as in any collegiate setting that we've talked about, how do I go out and bill for third-party services? There certainly are some of the indications here. What my quest is for you is, what are the things that you and your legal team and your risk management team, your administration need to consider and need to understand when you're looking at third-party reimbursement? What are the legal implications? And again, what I have listed here, what are the healthcare policies that you have for student athletes? What is written down? You probably, I would almost guarantee that all of you have policy and procedures. What do they say? What are the student athletes held to? Those are already listed. And if you don't, they may need to be more specific. And again, if your institution doesn't not have a policy and you're an NCAA school, there are specific standards that have already been set up as far as appropriate insurance and coverage and that sort of thing. You know, what is the licensure scope of healthcare professionals? Specifically, you know, I'm thinking, and probably you're thinking about I as an athletic trainer. You know, what is my scope? What is my license? What am I allowed to do in the state in which I'm practicing? Are athletic trainers recognized by the insurance companies within this state? Or am I going to bill under my athletic training license? Am I going to bill under my physician license? So that going to who's the healthcare provider designated as a billing authority. Understand that and be able to go with that. From the determination of the sports medicine services, you know, how much revenue can you really expect? And we haven't gone into in this presentation any amounts or getting specific with that, but we have related to that from a medical necessity standpoint that probably only about 20 to 25% of what we are seeing and treating in the athletic training room meet appropriate standards to bill the insurance company. And even with those medical necessity injuries, if it's an ACL or rehab that we're doing and we're seeing that client or that student athlete 5 times a week, should we actually be billing 5 times a week? Are we really laying hands on and providing the professional skilled care as a licensed professional 5 times a week? Or at least a couple of those times a week, are we more supervising and the student athlete is working with a student or themselves or et cetera, doing the exercises that and modalities that we've set them up on, but we're not actually touching them? Again, is that meeting appropriate standards? Documentation, again, one of that fun topic that none of us like talking about. Are we meeting standards? It takes time. We can become much more efficient as we talked about it, have good EMR systems and et cetera to do that, but are we doing it and we're doing it appropriately? And then the last thing on meeting the in-network, out-of-network standards. Is this legal? This truly is a legal question. And if we're a Division I school, in which, as we saw earlier, 86% of Division I schools, the student athletes pay nothing, which would also indicate their parents are paying nothing for an athletic injury. So where are the payments that the money, the copays, the deductibles that is part of that plan, how are they being paid? And again, that it's for another discussion to do that as we get in and talk about secondary insurance and et cetera. But we have to truly understand, is this, are the legalities being followed here? We want to make sure that we're not in any type of fraudulent situation. None of us look good in stripes, and so we kind of want to stay away from that. Really, the reason that we're looking at billing is we're wanting to generate additional revenue. So I've put down some considerations just to throw ideas out there that you very well may or may not have thought of. And again, these could be topics of great discussion and a full-length course as well. But in conducting and billing for the pre-participation athletic physicals, chances are you do have physicians that are doing that. These physicals could be billed under the physician. If they're being billed, the first time during the year, there's a good chance that they will be covered under many of the policies that we've got. So there are opportunities. But as many different athletic trainers as maybe hearing this course, there are different situations on how you are handling your pre-participation exams. So, but that is an opportunity that could be looked into. The possibility of what I call the select medical model. Select medical model is there's a lot of athletic training, sports medicine programs that work with an outside physical therapy group to provide rehabilitation and work on relationship there where the outside rehab group is paying for access. They're paying for equipment and space time to treat. They're actually doing their own billing. There are a lot of different business methodologies that can be looked into this, but a number of universities do this, and Select Medical, I utilize this because Select Medical model has worked diligently on this system, and so I kind of point this out and what I call them myself professionally, I call it this. Having partnership opportunities with your local orthopedic surgery group or health system or other sports medicine group. There are many different situations that I've worked with universities where either the health system or the local health or orthopedic group are going together to actually put up a building or outfit the sports medicine facility, provide additional sports medicine staff or equipment, due to different business relationships that are quite legal, but it's very important to have your legal team and sometimes bringing in an outside consultant that specializes in the medical legal law to look at this to make sure that that all legal issues are being followed here. But there are business opportunities in being able to partner that can drive some revenue back to the Collegiate Sports Medicine program. These are some of the resources that I've talked about here, or certainly listed, that you would have on the NATA website. There are at least 4 papers, and there very well may be others that you can go to. The legal work that I talked about, CSMI actually paid an attorney and myself as a consultant to research this, and then the attorney actually put together a white paper listing this and went through all this information. So great resource for you all to get that, and just reach out to them. Again, these are some of the references that we've seen from this. Never tell people how to do things, tell them what to do, and really that means tell them what needs to be done, and they'll surprise you with their ingenuity. Important here is I'm wanting you to understand all the things that need to be considered to look at, that if you are looking at billing, third-party reimbursement in the athletic training room, the sports medicine program, that you understand all the multiple aspects that need to be considered, looked at, both from a legal standpoint as well as a business standpoint. If you're able to go through and answer all the questions appropriately and check all the boxes, then you can know how to move forward, and you will know that you're doing it from an appropriate legal and business standpoint. With that, thank you so much for your attention. I do hope that this has added value to your life, and if you're looking your professional life in the collegiate setting, if you're really looking into this, that this would give you additional resources in which you can be able to utilize to answer some of the questions that either you have or you may be being asked by administration. Thanks again so much for your attention, and I look forward to hearing from you. If you have any additional questions, just go to the tcga.biz website. Always happy to talk to you. Thank you.